A question that is often asked is, what is an anal tag? What is an external hemorrhoid? They're basically the same. Anal tag is referring to the skin on the outside, which is what you can visibly see. Anal tags generally form because of a previous thrombosed hemorrhoid. And so they're linked very much so. And even when you remove a tag, you're removing the veins typically that are associated with that tag. Usually somebody's had a thrombosed hemorrhoid or a hemorrhoid that was enlarged at some point, and that stretches the skin. And much like in bariatric surgery for people with morbid obesity, they'll get that stomach surgery, lose all that weight, and then they need to have what is commonly known as layman terms as tummy tuck or abdominoplasty to remove that excess skin. And the key thing is that human flesh or skin, once it stretches, essentially loses its ability to de-stretch or shrink back down. And so no different than that morbidly obese patient that has a big surgery to lose weight and then has to do something for the excess skin around the body. Around the anal area, a hemorrhoid at some point in someone's life stretched, the skin stretched with it, the hemorrhoid vein reduced itself, but the skin stayed enlarged. And that is what an anal tag is and why it's so linked, or there's this confusion between, is this an anal tag or an external hemorrhoid? Anal tags in general are not dangerous. So little danger, if you would want to say, that insurance won't even cover removing an anal tag. They consider it a purely cosmetic procedure. So is there any risk of having a tag? Not really, no. Why people choose to remove it really falls into two broad categories. One is they just don't like it, so it is cosmesis or cosmetics. They don't want it to look like that down there. And the other is for some patients it's a hygiene issue, that it becomes harder to clean themselves after bowel movements and doing proper hygiene because, let's just say, debris from that region of the body gets trapped there and becomes harder to clean with toilet paper or even with water. Excision of anal tags overall is a very simple process. It's still a procedure, it still involves scalpel, it still involves bleeding. But essentially you need to remove that skin in a way that respects the planes of the body and respects the natural opening of the anal area. And so, well, I guess simple to me, but more complex for somebody who doesn't know, but for somebody who is an expert in that part of the body, that anatomy becomes very natural to me. What we want to do is respect what the natural 360-degree opening is for that bottom. We don't want to minimize it, reduce it in size, or widen it in any way. We want to keep it as is, while removing the skin in a way that it heals naturally and looks as if it is. A common question people ask when coming for anal tag procedure is, now that they've noticed the anal tag, what they've typically done is taken an iPhone or the like, a smartphone, and taken a photo of the area. And what that does is it enlarges an area that they had never at once paid attention to. And when you look at the anal area the first time in an enlarged way, you're going to notice multiple little folds around the area. Well, the anus needs those folds. Think of it as, and I always do this to patients, if you were to take your thumb and finger here and stretch them out, but then close them, when you close them, you're going to see multiple folds along the skin. And when you open them, those folds go away. That skin is important, and it's necessary to keep those excess folds there because you need to be able to accommodate opening for natural bodily functions. What we need to do is remove the excess, which is the anal tag, that brought it to your awareness in the first place while respecting those folds. Very important that those folds are respected. I've seen many patients where surgeons told them they'll do whatever they want and removed the natural folds and made now the anus unnatural. And they deal with very difficult problems where they get constant tears because there is no excess tissue there to allow for the opening when they want to do normal bodily functions. The removal of anal tag has two broad kind of theories or studies in terms of how to do it. One group really advocates that you should suture the area closed. The other group advocates that you should remove it and leave the wound open. While thinking that to suture it sounds, well, that should be easier in recovery, believe it or not, it's actually harder. The US standard is to suture the wounds, and it's what most surgeons in the US do. They remove a tag, and then they suture it closed. In Europe and abroad, they advocate not to suture it. I found in my practice over a decade that Europe wins in this argument on multiple fronts. Cosmetically, it looks much better when we don't suture an anal tag closed. Also when, for instance, if you have a circle and you were to take out a piece of that circle and then try to suture that circle closed, you're actually in that motion of suturing, narrowing that circle. You're narrowing the aperture. And so what happens is one of two things. Either the sutures will rip open, which it does in a very large percentage of patients, which is very painful, and actually leads to a very acosmetic or non-good looking way for it to heal. And also that it could narrow, if it does close properly, it could also lead to a narrowing of the anal canal, which we never want to see. And so for all reasons that it provides a better cosmetic result, it hurts less, and it actually heals more naturally, it's better not to suture an anal tag when you close it, and it leads to far better outcomes. Are anal tags dangerous? Not at all. They're just a nuisance that can be dealt with very easily. It's an outpatient procedure that we do here in our office. Very, very rarely is it something that we need to do under anesthesia. And that decision really comes down to, when I examine a patient, am I worried that that vessel that led to this original anal tag, is it going to be a problem? Is it coming from the inside out, and am I going to have a problem controlling it? Because doing more advanced procedures within the canal is very hard to do with a patient awake. It is in the rarest of occurrences that that is the case, but that's the main thing we're looking for. Am I worried that I'm going to have something that I'm not going to be able to easily do while the patient is comfortable in the office? For patients with multiple anal tags, we typically stage those procedures out. We remove one, maybe two, but not all at once. And the reason is that the anal area, when it heals and it has wounds, it uses the other tissue that's still in place and is normal as its scaffolding or blueprint to know how to heal properly. If you remove too much, the anus loses its guide of knowing how to heal properly. And if we do that, you run the risk of it closing itself down into a more difficult problem called anal stenosis, which is actually a very difficult problem to treat, requires much more advanced procedures. And so because the risk of that is so severe, we typically will stage out doing one, maybe two tags, letting the area heal, and then following up with the subsequent one, just to make sure that we never violate the principles of the anal canal and how it likes to heal. Why here? Why get your anal tag treated here? Couple reasons, but they're good ones. I'm a board-certified colon and rectal surgeon. My training was in the anal rectum and advanced cancers. It's what my focus and my specialty is, not cosmesis. So how did I come into this? Well, happens to be time and location. I practice in Beverly Hills, and I have a large subset of people from the industry, be it Hollywood, modeling, movies, that come to my office for this. And so it's something more that I fell into, but needed to fall into, and make sure that I had kept my patients happy and provided them results that they really were happy with. Best compliment I ever got was from a nurse that we're preparing for a much larger surgery. She saw on the chart that this patient had had an anal tag excision with me. She hit me on the shoulder and she said, "I know who I'm going to now." And so it's just something that naturally came because of my training and the area I live in.